So there is finally a sense of hope after this COVID madness which has gone on for so long. How exactly does the Oxford vaccine candidate work? We have the story.
Success in Oxford raising hopes in India. The Oxford vaccine against the coronavirus has shown an average efficacy of 70% between two kinds of doses. But crucially, the efficacy is 90% when the dose is half and then a month later full. This saving would also make more vaccine doses available. Adar Poonawala Serum Institute of India is already producing this very vaccine for India.
By January, we should have 100 million doses minimum, because we've already made 40 million doses. We're putting an MRP of 1,000 rupees. In the private market, we'll sell it at 500 to 600 rupees, giving another couple of hundred rupees to the distributors and others to be able to make their margins. But to the government of India, they will be buying it at 250 rupees or less, which is roughly $3 a dose.
However, the efficacy falls to 62% with 2 full doses given at least a month apart. Why there's such a difference isn't clear yet.
We do have a subgroup who got a half dose as the first dose and then a full dose as the second dose, where we saw 90% protection. So I think these are really exciting results. And because the vaccine can be stored at fridge temperatures, it can be distributed around the world using the normal immunization distribution system. And so our goal, as the Vice Chancellor said at the beginning, to make sure that we could have a vaccine that was accessible everywhere, I think we've actually managed to do that. So it's a very exciting day today.
The UK-made vaccine, the Oxford vaccine, is the third to report its efficacy. The other two vaccines, Pfizer and Moderna, are made in the United States. The other two vaccines have also actually reported a higher efficacy. But India has a tie-up in place with the inventors of the Oxford vaccine and not the other two. Now, the Oxford vaccine also comes with one big advantage for India. It can be stored in a refrigerator, doesn't even need a freezer, which essentially means lower costs in storage and transportation compared to the other two. Therefore, the vaccine will cost less and be more easily available.
So how does the Oxford vaccine work? It is a modified virus that causes infections in chimpanzees. It now contains the genetic material of COVID-19 virus, spike protein. After vaccinating, this spike protein triggers the body's immune system to attack the coronavirus if there is an infection later. But the Oxford vaccine isn't the only one India is banking on. Among the others, the indigenous vaccine being made jointly by the Government of India and Bharat Biotech has started the third stage of clinical trials. And there is the Russian Sputnik V vaccine, which its makers claim has 92% efficacy, which also is doing trials in India. Rishika Barua, NDTV.
Well, that's the future still. We want that vaccine to be here sooner than later, but for the moment and for the indefinite future as well, RT-PCR tests, which are widely considered the gold standard in testing for the coronavirus, it's all important. It's quite expensive now, and therefore there is a real urgency to bring down the cost. But now there appears to be hope. Spice Health, a healthcare company founded by the promoters of SpiceJet and led by Avani Singh, Ajay Singh's daughter, they've launched the most affordable and fastest RT-PCR testing facility in India today. The test will cost 499 rupees. The reports will be available within 6 hours. The first test lab was inaugurated at the Indian Council for Medical Research in Delhi by the Home Minister and the Health Minister. SpiceJet had signed an MOU with the Indian Council for Medical Research and has been certified for what they've now brought to the table. Under the first phase, 20 portable labs will be set up. Well, joining us now, Ajay Singh, the Chairman and Managing Director of SpiceJet, and Avani Singh, who's the CEO of Spice Health. Thank you both very much for being with us. Mr. Ajay Singh, let me come to you first. Aviation to COVID testing, that's a huge jump. When did you decide to do this?
Well, honestly, Vishnu, this COVID testing is more of Avani's initiative. I think she's actually borrowing from SpiceJet's, old history. Just as we started low-cost flying in the country, she means to provide low-cost testing. And I'm very proud that she should be doing this.
So, Avani, tell us a little bit about the cost, number one, and how long is it going to take?
Sure, Vishnu. So like you mentioned, we're offering these tests at 499 rupees and the results will be available within 6 hours. These are RT-PCR tests that we are offering, not rapid or antigen tests. And they'll be delivered through portable containers in which we have created labs, which will be installed in various containment zones throughout the country.
So that's the goal, is it, Avani, that you're going to install this in containment zones and whoever needs to get tested will get tested there? Is that your first priority?
So, right, we are starting with that. We've tied up with ICMR, which is, of course, as you know, the body which is at the forefront of the fight for COVID in the country. And through that, we'll get access to state governments and install these containers and labs in containment zones first, since that's where cases are spiking the most and RT-PCR tests are available the least. And so the need is the highest. However, obviously, going forward, we would like to administer these tests to as many citizens as possible. And so we'll be starting a B2C model as well, and we'll be administering these tests to as many citizens as we can.
And Mr. Ajay Singh, in terms of the rollout, where do you see this being rolled out first and in what numbers?
Vishnu, I think the thought process really is that the more testing you can get, the faster we can get rid of COVID in the country. And of course, there will be much more testing if it's more affordable than it is currently. So the idea is to maximize these tests. And to start with, we are starting with Delhi because that's sort of the hotbed at this time. A lot of infections happening in Delhi. And I think the first unit is going into a crowded market in Delhi. And I think the first 10 units will be in the Delhi NCR area. But of course, many state governments have approached us and we'll try and put in place as many labs as is possible. And the objective in the first phase is to of course, Avani and a team have spoken about 20 labs, but given the kind of demand that this is seeing, I would think that this will probably be closer to 100 labs that will need to be deployed.
And Avani, when we speak about the facility itself, what is it? It's a walk-through facility and the testing is done in this. What exactly does the lab look like? Is it a truck which is sort of catered for this?
So it's essentially a container which has been put on top of a truck, and the container simulates a fixed lab. So all the fixtures, the technicians and all the facilities to the highest quality are built within this container. So it's essentially just a lab on wheels. And this lab is of course portable and hence can be put in areas of high demand and high need.
And Avani, obviously training your technicians to ensure that they get it right, that's really important. So has that training process already started?
Absolutely. We have already started training many technicians, and one lab is already functional. Another 5 will come up by the end of this week. And we intend to build up at a rapid pace since that's the need of the hour.
And Mr. Ajay Singh, in terms of the kit itself, which helps you to test and helps you to test at this speed, how did you go about picking this kit? And what kit did you exactly pick? Is it just one type of RT-PCR which is available, or do different companies, different providers have different kits which you can choose from?
No, for the moment, we've chosen to technically collaborate with a company called GeneStore, and they have a RT-PCR kit which has been approved by ICMR and is in fact being supplied to a large number of laboratories around the country already. So it's a tried and tested product, and we are using the highest standard of the machines and equipment that is available around the world. So the testing is absolutely of the highest possible level.
Avani, how many tests would be possible per day per unit?
So Vishnu, per lab, 3,000 tests per day with 2 to 3 machines is what we're aiming for, and is the capacity of the lab at present. And we hope to be able to scale up with putting more equipment and more manpower in the future.
And there would be a protocol, Avani, as well in place, right, for you to accept patients, social distancing as they come in to test, constantly cleaning the lab itself. All of that would have been factored in, right? Could you tell us a little bit about that?
Absolutely. So, like Mr. Ajay Singh, my father mentioned, everything is to the highest quality. So we're sanitizing the lab consistently throughout the day. After every cycle is run, the lab is sanitized, and social distancing and security is maintained even in these containment zones. This is why we have tied up with ICMR as well as state governments to be able to implement this so that we can have joint security and ensure together that social distancing and security is of utmost importance, and that people do not, develop the disease in the process of trying to get tested.
And Mr. Ajay Singh, what happens next? I mean, once you are tested, you wait 6 hours. Is the result then WhatsApp to you, or do you have to go to a website? Are you setting up a special website, and do you pay before the test or after the test?
Vishnu, to start with, I think the tests are being conducted in collaboration with ICMR and the state governments.
Right.
And the results will be made known of course, on electronic media. There is now no question of providing, paper reports. The test results will be sent through WhatsApp and through SMS and so on. So people who come in will see there are two kinds of tests. One in which the government has registered the patients, collected the samples and provided the samples to the labs for results. And in other cases where the collection is happening in collection centers which are set up next to the labs. And in both cases, of course, all the details of the patients are known, their phone numbers and etc. are known, and the results will be communicated on their phones.
All right. Well, it sounds like a really solid initiative, and I'd like to thank both of you for doing this. Avani, thanks very much for sharing those details. Thanks very much.